The doctor is in. It's On Call with Dr. Howard Smith.
Dr. Smith is ready to take your calls about the latest news and trends in the world of medicine.
And now, Dr. Howard Smith.
Sneaking round the corner, could that someone be Mac the Knife?
Yes, Dr. Howard Smith in and at your service. And from the beginning of this podcast series, we have talked about the treatments for ear problems, nasal problems, with an eye to avoiding surgery. Today, we must come to grips with the possibility that your child may need surgery. And today, we'll concentrate on surgery for middle ear disease. We'll talk a little bit about what is tube surgery. We'll talk about the benefits and potential complications of the surgery. We'll talk about the follow-up necessary for this surgery, since we are putting plastic prostheses or steel prostheses into a child's ear. What kind of follow-up is necessary? Also, parents want to know, will my child require more than one set of tubes? And of course, you'll also want to know the details about the operative procedure to insert the tubes. We'll talk about adenoidal surgery as well, when that can be a benefit, what it is. All right, early birds, just for you folks that like to be on top of things and be the first, let's talk about when you should consider tube surgery for your child. The decision to proceed with this type of surgery should be based on a very careful benefit-risk analysis. Now, the benefits are greatest in children who are not responding to maximal medical management or whose repeated ear infections create hearing problems and subsequent language problems as well. So let's talk about the indicators. Persistent ear infections not responding to combination therapy using the strongest antibiotics combined with oral steroids, particularly if your child's irritable, feverish, wakeful, and clearly ill, or can't tolerate the medications. Second indication, breakthrough otitis, breakthrough ear infection episodes in a child who is already on antibiotics on a continuous basis to try to prevent such infections from coming through. Breakthrough ear infections in a child who is using antibiotic prophylaxis, that is, antibiotics only during colds or during teething, so-called episodic antibiotic prophylaxis. Also, the repeated spontaneous development of ear infection episodes without accompanying colds or upper respiratory infections, making it virtually impossible to time any type of prophylactic antibiotics. Next, the repeated development of ear infections associated with eardrum perforations. This is a very serious problem because it indicates that the infections are creating real damage to the eardrum, middle ear space, and possibly to the ossicles. Now, if fluid is observed consistently in one or both ears for more than 6 months, even if your child seems to be hearing appropriately and hearing seems normal in formal testing, that child should have that fluid drained and tubes put in. Now, if fluid's observed in ears for more than 3 months, but the child is definitely experiencing trouble hearing, learning, paying attention, or is having other behavioral difficulties, that would be an indication for tubes. The consistent or fluctuating eustachian tube dysfunction for more than 6 months, if your child is experiencing hearing, learning, attention, or the behavior difficulties. And, of course, the deterioration of the appearance of the eardrum, including the development of saggy eardrums with so-called retraction pockets, beginning of retention of skin debris on the eardrum, or the appearance of bony erosions involving the visible ossicles. So all those things, early birds, are reasons why your child should have tube surgery.
Dr. Howard Smith.
Today's podcast is brought to you on some pro bono commercials by two of my favorite discussion items. Ear Check, which is the home monitoring device which can help you know if your child is having acute, chronic, or fluctuating ear problems, particularly middle ear problems. And we'll also talk about topical antibiotics for ear infections. Another goodbye from the good guys and girls. Well, folks, let's first talk